Guys, I'm coming to you live on a Wednesday. It's a little after 1 o'clock, and in between morning shift and evening shift. And I had a couple of interesting patient interactions, and this has been over just in the last week. And I'm assuming, guys, that if I have had these interactions, chances are that some of you, or maybe even a lot of you, have experienced this, maybe with working with your doctor. All right. And so it got me thinking because just a couple of days ago, actually, this happened today, but I'm going to give you a couple of experiences that have taken place over the last couple of days. But today, so I had a patient who's been doing absolutely awesome, absolutely fantastic, and actually have helped him get off of medications. And don't get me wrong, guys, just so you guys know this, I am not licensed to get people off of medications. So just so you know that. I don't have a license to. And so I can't actually legally do that, nor do we actually try to do that. And in fact, one of the things that we have to do is we have to try to work with a doctor who is willing to go off of medications, or who's willing to actually start to taper off certain medications. And it depends on the medication that you are taking. There's a difference between things like blood pressure medication or cholesterol medication. And there's also a big difference when it comes to like antidepressants or things that are anti-anxiety medication and things like that. There's a difference between how you should actually help, or I should say how a doctor should help a patient be able to go off of those medications. So the patient today, he said, yeah, I went, I just, I had to get my yearly checkup with my doctor. And I asked him, I wanted to get off of this ADHD medication that I have been on for the last, I don't know, 15 or 20 years. And so I just wanted to run it by my doctor because I'm doing so good. I don't even think this medication is even helping me at all. And just remember, the doctor's putting you on ADHD medication. There is actually no testing that they do that actually warrants them to be on some kind of ADHD medication. In fact, it's actually based on a set of symptoms, and who comes up with the symptoms? The drug companies do. And so that's why you see so many more people that are diagnosed with problems with ADHD and depression and things like that, is really because it's just based on a set of subjective symptoms, and there is no testing actually for it. So with this individual, he goes to the doctor and he says, Doc, I want to lower this medication. I'm getting healthier. I don't think that it's actually really helping me at all anymore, because I've started to work on some things with my lifestyle. And he said the doctor looked at him almost as if he had a third eye. And he said, wait a second. We don't ever take people off of these medications. No, they stay on them for the rest of their life. And he even admitted, I don't even know how to take you off of this medication and what I need to actually do. And so he had this battle with his doctor because his doctor knew when to put him on a medication, but he didn't know when to take him off, or he didn't know how to prevent him from having to go on the medication in the first place. So here's my question, guys. Your doctor is trained to put you on medications, but are they trained to know how to help you avoid them? Or are they trained to know when to take you off of them? See, shouldn't that be the whole goal of a doctor? Don't we go into this profession in order to improve a person's health? You don't walk into a doctor's office and take 5 medications and walk out of the doctor's office healthier. They just are manipulating chemically into trying to put out a bunch of fires. Now, is there a time and a place for that? Absolutely, there is. But the goal should be this. Should say, hey, Mary, Mrs. Jones, Mrs. Johnson, Mr. Johnson, whoever it might be, right now, based on these set of tests or based on some examination that I have done, according to my training, this would warrant you to go onto X, Y, and Z medication. However, this is what we want to do. You have a fire right now. This is going to help to put out the fire. But you know what? What I would really like to do is not have to put out this fire for the rest of your life. So what we should be doing is we should be working on specific things with your lifestyle so that we can actually get you off of this medication so that you don't become a slave to it for the rest of your life. Now, let me ask you a question. How many times does this actually happen. And I do not see it. However, when people start working with us and we start working with their lifestyle, and you see things like their need for blood sugar medication goes down, cholesterol medication goes down, their cholesterol, blood pressure medication, other things like ADHD medication, or maybe they're feeling happier because we have actually improved health, and some of those things that are actually involved with digestion and also affecting brain and mood is starting to improve. The problem is patients are so frustrated because there is no plan. See, doctors are experts at putting out fires, but they're not experts into trying to find out what caused the fire. And they're also not experts in how to prevent you from having a fire in the first place. So this doctor looked at him like he had a third eye and said, I don't recommend it. I don't recommend it. In fact, I recommend that you stay on this low-level amphetamine for the rest of your life. And so patient says, well, what do I do? Well, I say you find a new doctor. You find a doctor who has a vested interest in you becoming healthy, and you work with a new doctor. See, what do you do when a doctor is refusing to do that or work with you? What do you do with a doctor who is refusing to run the right labs? You fire your doctor and you work with a new doctor. See, so many times people say, well, I really like my doctor. I really like them. And that's fine. You can like your doctor, but just remember, there's a lot of nice people who can be incompetent. And there's a lot of people who aren't so nice, who are extremely competent. So your first thing when finding a doctor is saying, are you competent? Not, are you a nice guy? Because there's a lot of people who love their doctor and who stay perpetually sick. And at that point, the only person that it's serving is the doctor, and it is no longer serving you. And in fact, another interesting example happened just the other day. So we had a gentleman who we have helped lose almost 50 pounds over the last 3 to 4 months. And he was actually put on a blood pressure medication and had a severe reaction to it, It was so severe that he wound up in the emergency room. So he had a reaction to the medication that the doctor put him on to try to lower his blood pressure, but the doctor gave no advice, no training, no direction on what he should do in order to be able to improve his health so he could go off of the blood pressure medication. But you know what they say. And what they say is this: well, start eating better and start exercising. But they don't say, here's how you should eat. Here's how do you lower an inflammatory response. Here's what you do. Here's how you work on the liver. Here's how you work on the gastrointestinal system. Here is how you start to restore the body so that the body can go back to normal. When which the body goes back to normal, so does blood pressure, and so does cholesterol, and so does blood sugar, and so do your stress levels. So the doctor just says, eat better and start exercising. But beyond that, I can't tell you anything in which you are supposed to do. So again, they're trained to put you on medications, but are they trained to teach you how to avoid them? Or are they trained in order to know when to be able to take you off of them? So this gentleman goes and follows up with his doctor, and his blood pressure is back to normal. But here's what the doctor said. The doctor said, you know what? I know that your blood pressure is normal, but I am I'm hesitant to take you off of this medication. You see, because we always put people on, but we never take them off. And so the doctor didn't even really know when to take a person off of a medication. And you know what? In some aspect, I get it, because they are scared to death of liability and scared to death of not following the rules. And remember this, who makes the rules? Not the doctor. The doctor doesn't make the rules. They're no longer allowed to be able to practice medicine. And in fact, what they do is they have a sheet of paper, and the sheet of paper tells them in this instance that you should put them on X, Y, and Z type medication. But how many times, guys, I could count it numerous times in which a patient goes back to the doctor and their thyroid is improved, or they've off a blood pressure medication, or they've lost 50 or 60 pounds, or they're no longer addicted to pain medication, or whatever it might be. And the doctor looks at their labs and they say, wow, I don't know what you're doing, but just keep doing it. And isn't that sad that the doctor who has been your doctor for 20 years, who has actually monitored your health and has led you into a disease state because they haven't properly tested you, or nor have they given you the advice and the direction on what you need to do in order to prevent fires, they're not even interested in saying, what did you do so that I could continue to help more people avoid being on medication? And I've never had a doctor that has actually asked a patient, I need to know exactly what you are doing. And in fact, I've never had a doctor who has called me up and said, I need to know what you are doing because this is how I would like to practice. It's never happened, not once. And in fact, and sometimes they actually get upset because the patient has actually gotten healthier than the level of knowledge and expertise that the doctor provided. And I know is that it can be very discouraging when you spend your life learning how to put people on medications when everybody wants to not go on them and learn how to prevent them in the first place. See, people today, they don't want to be manipulated. They're tired of it. They want to be restored. No longer do they want to be manipulated with more and more drugs and medications. So the question I'm going to ask you again is, your doctor trained to put you on medications, but are they trained to know when to avoid them, or how to train you how to avoid them and when to be able to take you off of them? And I see it happen all the time. See, just remember this. A doctor is someone who is an expert in their profession, who is an expert in their field, which means being a doctor in the field of medicine is the diagnosis of disease and the treatment with medication. And if that's what you want, then you found the right profession. But if you want to know how to prevent it, how to be able to start getting your body healthy so that you can start going off of them and restore your body and not manipulate it anymore, then you need to find a new doctor, and a doctor who's an expert in health, a doctor who's expert in restoration, a doctor who's an expert in rebuilding the body after a fire, like a carpenter, and not someone who knows just how to put fires out. Guys, people need this more than ever before, but too many times I see ego get in the way of what's best for the patient. So what about your doctor? Is your doctor trained in doing this? Is your doctor willing to work with you? Is your doctor willing to give you the direction on what you need, not to need medications? And if they are unwilling to do it, it's time to fire your doctor, and it's time to actually find a new one. Because remember, it's your health, it's your life. You have one shot at life. Stop using a doctor just because they're a nice person, and start going to one who is competent in what they do. And hopefully, maybe they might be nice as well. So guys, I always appreciate you guys being live. Make sure, guys, share this with people, because there's a lot of people who are left struggling. They have been misled into thinking their health is fine, and they haven't been tested properly. They haven't been doing the right lifestyle, and it's led them to a path of becoming sick, and they've medicated and they don't know how to get out of it. So share that with someone. You might just change their life. So guys, I hope you have a great Wednesday. Enjoy the rest of your hump day. And I hope you guys also have a great weekend. All right.